We have quite a busy week this week with surgery scheduled every day. One of our patients yesterday had her leaking mitral valve repaired, and she's making a very good recovery in the intensive care unit. We got her sitting in a chair today and doing some gentle physiotherapy. The mitral valve separates the heart from the lungs, and it consists of two leaflets, like two doors, and these have to close at the same place to prevent any leakage. So in this patient, one of the cords supporting one of the leaflets had ruptured. So this leaflet was closing a bit higher than normal, and so there was a gap between the two leaflets, allowing blood to leak through the leaflets and backwards towards the lung again. And so she had felt a bit breathless, and the heart had enlarged to compensate for the leakage. Some patients with this condition are asymptomatic because the heart continues to enlarge to try to pump more blood out, and this does compensate for the leak, but a big heart is not good, and so it is best to repair and correct the leak before the heart gets too big. There are a number of ways to correct a leaking mitral valve, and in this case we chose to do a quadrangular resection. So we resected the defective part of the leaflet and then reapproximated the remaining good leaflet together back again to recreate a normal mitral valve, and this worked very well. We also often repair valves by using artificial Gore-Tex. Like in this case, we can suture the Gore-Tex onto the heart muscle, the papillary muscle, and then the other end to the defective leaflet, and then we can then tie the Gore-Tex and adjust its length so that the two leaflets would then meet together at the same place. In most patients, we are able to repair a leaking mitral valve, and this is the best treatment for the patient because it is all your own tissue and there's no need for any strong blood thinners, and it will also last your lifetime in most patients. In some cases, if the valve is too badly diseased or the tissue quality is poor, then we may have to replace the valve with an artificial valve. So thank you very much for listening. I hope that was informative, and I hope you have a good day. Thank you.